Welcome to the Vision Quest video series, a step-by-step guide to holistic health. This program will discuss the Alexander technique. Hi, my name is Toni Gallardi. I'm a psychotherapist, talk show host, and writer. I've been working with people in adult transition and crisis for about 15 years. I did a talk show for 2 years called The Toni Gallardi Show that interviewed risk takers, people who had left chaotic lives and impassioned their lives with brand new vocations. And then I went on to start a book called Lifequake, which is all about a 7-stage map to a whole new way of being an adult. We'll be discussing the origins of the Alexander technique. You'll be seeing footage on Frederick Mathias Alexander, the Australian actor who invented it. The benefits of using the Alexander technique, such as in chronic conditions. You will see examples of techniques used by a practitioner. You will see how many actors use this technique and find it very beneficial in their practice.
The Alexander technique is a natural, relaxed method of promoting good health through more efficient use of body movements. By using the Alexander technique, posture can improve so that the body is able to work in a more natural and efficient manner. This therapy is said to be completely safe, promoting a harmonious state between mind and body, thereby alleviating or eliminating a number of medical conditions ranging from back pain to headaches.
The Alexander technique is a system for undoing your habits, inefficient habits of movement and harmful habits of movement. And it's a system which allows you to release the unnecessary tension and pressure that most people put on their bodies during their, in their everyday movement. It's a very broad system in terms of its application and its implications in terms of what happens to people. Used by people in a very practical sense in the performing arts. Myself, I come from a dance background. Used very much with actors, with people who use their voices professionally, and with musicians, very popular with musicians. So in terms of improving your coordination and returning to that natural, fluid, reflex-like movement quality, the technique, that's essentially what the technique does for you. But of course, a good part of my practice and a good part of a lot of Alexander teachers' practice is this working with people, assisting people who have chronic injury or pain conditions, many of which, even when they were originally caused by an accident.
It's a process of conserving energy for myself. So that is in movement, that is in thinking, in feeling. So it's kind of a very wide range that the Alexander technique encompasses.
For most of our lives, many of us do not adopt the right posture, even when simply standing up. This is caused by slouching and round-shoulderness, which may lead to aches and pains. Attempts to correct this problem can often cause other problems by overcorrectness, pushing the upper body forward. An Alexander teacher will aim to show an individual how they can stand tall in an aligned and balanced way with a minimum of muscular effort. Bad habits such as bad posture, learned over a lifetime, are often so ingrained that they feel normal and natural. To rebalance posture, Alexander teachers often advise the following. During walking, a slouch posture should be avoided. Walking should be balanced with the weight being evenly transferred onto alternative feet as the head is rested on top of the spine with the shoulders relaxed. During sitting, the head should be free poised, relaxed, and the knees should be a little apart to avoid rounded shoulders and the compression of the stomach.
Well, bad habits develop, and if you watch watch people from a very young age, you'll find that they have a very natural, but very fluid and easy manner of moving themselves. They are very present and very immediate in their response to stimulus in the way in which they move. As people grow older, you see more and more tightness, rigidity, limitation in movement coming into their movement patterns, becoming commonplace. And there are a number of reasons for that. I mean, there are obviously the reasons of increasing stress, emotional and physical stress that people pick up as they go along. there is also the fact that people copy those around them, their parents and so on, and will tend to respond to stressful situations in similar ways to, well, they learn how to respond to stress from their parents or from their peers and their school groups and so on. There's also the fact that children at an early age are forced to sit in a classroom situation for a long period of time, often in chairs or in circumstances which are harmful or unsuitable. So yeah, there are a lot of reasons. I mean, we see a lot of people who develop habits in response to pain or injury. You compensate when you have some kind of a pain. That compensation is a form of tension, and that tension very quickly becomes a habit. You no longer are consciously aware that you are tensing yourself, but you are in fact tensing yourself. So the experience often of people coming to the technique is that it seems almost magical that we are able to produce a sense of ease and a sense of release very quickly because they weren't aware that they were tensing themselves in the first place. Well, the Alexander technique was developed by F.M. Alexander, and he was born in Tasmania in 1869. He was not a very healthy child, and developed at an early age developed a very strong interest in Shakespeare and in theatre, and decided, even before his teen years, I believe, decided that he was going to become an actor. So that's what he did. He worked very hard. He lived in Tasmania. He went to the Mount Bischoff tin mine and worked there for a couple of years to earn sufficient money to travel to Melbourne, train, and to become an actor. And in the early part of the century, he was very successful as an actor, sort of an up-and-coming new actor, and was working very well. And he began to experience a recurring problem with his throat and with his voice. Particularly, he would get a sore throat, his voice would become hoarse, and people began to comment that they could hear him gasping for air in between his statements, and kind of go, well, he'd say something and then he'd go and kind of pull his air in like that. Of course, something which is not regarded as good form for an actor. So this was of quite concern to him. And it was one of those problems that, like a problem a lot of people have, it kind of came and it went. But gradually over time, it got worse. He went to see doctors and the specialists of the time, whoever was available, and wasn't able to achieve any relief in that. And it came to a head when he had a critical performance on, and he went to the doctor a couple of weeks before the performance, told the doctor what was happening, and the doctor said to him, well, if you want to have your voice, you must rest your voice for the 2 weeks. Which Alexander did. He rested his voice. I think he probably used his voice for speaking, but he certainly didn't practice any reciting. And then the day of the performance came, and he got up on stage, and he was in fine form, and everything was going very well. And of course, by halfway through the show, he was becoming a little sore. His voice was starting to go. By the end of the show, he could hardly even speak. His voice had gone. And as you can imagine, for a young actor, that was devastating. That was, as far as he could see, that was going to be the end of his career. So he went back to the doctor. He told the doctor what happened. And the doctor said, well, Mr. Alexander, we have to continue with the treatment. And Alexander said, no, I won't. And of course he said, no, I won't, because what he'd been doing wasn't successful. It didn't heal the problem. It didn't help the problem. And he made an observation, and this is where the work really begins with the Alexander technique. He said, when I am reciting, my voice tends to get worse. When I am simply speaking, it always tends to get better. Doesn't that mean that I must be doing something with my body or with my voice mechanism when I'm reciting that I'm not doing when I'm just speaking? And the doctor said, well, that makes sense. That's a logical thing. So Alexander said, well, tell me what it is. What am I doing? So I can stop doing it. And of course, the doctor didn't have any idea what he was doing. So he went away to find out for himself, and spent a considerable period of time over the ensuing 9 years, a considerable period of time watching himself in the mirror. At the beginning he had one mirror, and then later on he set up 3. And he simply observed his movement when he was speaking and when he was reciting. And over a period of time, as he was doing that, he began to notice that there were indeed significant differences between what he did with his movement when he was reciting and what he did when he was speaking. And then as he became even more sensitive and was able to see more clearly what was happening, he began to see that he did these movements that were harmful even when he was speaking, only they were much less. And of course he became fascinated by this, and that began a long process of experimentation and discovery. How can I stop doing the movement that I've been doing that causes this problem? And of course, you know what that movement was, don't you? It looks a little like this. And sometimes it looks a little like this. But you can notice that as I'm doing that, it causes my voice to become a little more strained, and my body begins to kind of collapse and slump down like that. And that little movement, if you watch people, you'll see happens to almost everybody. Almost everybody has a little movement like this going on in their everyday activities. He was encouraged by the doctors at the time to go to England, and he did so in order to introduce this new technique to really the centre of society in those days, which, as far as Australia was concerned, was England. And he practiced very much amongst the rich and famous, particularly the actors of that day, very successfully, and a lot of doctors began referring to him for respiratory problems and other conditions. As time went on, people became concerned that he was growing older and nobody else could do it, and that his results were so good that people really wanted to ensure that it continued, and so he was encouraged very strongly to set up a training program. And he did that beginning in 1930. The first training program began, and there were a number of people in that first training program, some of whom are still alive and still working today. And my first Alexander teacher, Marjorie Barstow, was in that first training program with Alexander. She studied with him for 3 years and then returned to the United States, where she came from, and continued to work and to progress with her own developments and her own understanding of the work. And I met her in 1976, I think it was, somewhere around there. No, not that early. It was 1986, 10 years too early. And she was 85 years old and teaching the technique then, travelling around the world. And it was a magnificent experience. It was fantastic. And that's really what convinced me to go ahead and to train as a teacher myself. Well, the Alexander technique is not really a psychology of movement. But then again, it's not really a physiology of movement either. It's something which bridges both of those areas. Alexander's word for this was that we're looking at your psychophysical use of yourself, the way in which you use yourself mentally and physically together, and how those two aspects of yourself work together and interrelate. He says in the beginning of his book, The Use of the Self, that when he first started, he really believed that mental and physical attributes were separate things, and that you could treat a mental problem in a mental way and a physical problem in a physical way. But what he discovered as he went through, and what he actually found in a very practical sense, was that he couldn't actually separate those two things. That the way that he was thinking about his movement affected what he was doing when he was reciting. And the way in which he was moving his body was affecting the way, his attitudes and the way in which he was thinking.
Well, Alexander considered the self as a psychophysical mechanism. So he said everything that everything spiritual, mental, physical gets translated into muscle tension. So if we look at how we use our bodies, that leads us back to how we might behave. And so the technique is kind of a holistic, the technique has a holistic approach to human beings.
You you may well find yourself sitting in a chair even now as you're watching the video. And as you're sitting there now, I wonder what would happen if you stayed still and had to sit in that position for, say, 5 minutes. Would that be comfortable? And for the vast majority of people, of course, it wouldn't. You would develop some kind of stress, some kind of tension, some kind of discomfort that would increase over time as you were sitting there. That discomfort, that sense of uncomfortableness is usually dispelled then by doing a little wriggle, kind of like that, or a little stretch. But then when you come back to sitting in the chair and just watching the video, very quickly some form of discomfort reappears for virtually everybody. The reason for that is because underneath just sitting here in this chair or sitting there in that chair, there is a very small, delicate movement occurring. And that movement is a movement that is tending to compress you. And it comes in part from what Alexander discovered with the tension in his neck and in his throat and the relationship of his head and his neck to his body. That movement is not usually discernible to people. You don't usually feel that. What the training does is it helps you to identify that so you can stop doing it. And of course, if you stop doing that, well, then you can stay and sit in a chair and be comfortable for a long period of time, as I can now, and continue to experience just comfort and ease. As I said before, learning the Alexander technique is essentially learning a skill. And once you have a skill like that, you've got it forever. You can use it whenever you choose. Your basic habitual movement pattern improves considerably and continues to improve as you go through lessons. So that when you leave lessons, even if you never think about it again, you'll still move better than you did when you started. Okay? If you wish to continue with the work, you will have the tools and the ability to do so completely by yourself. You know, some people have regular exercise regimes that they use, and they do a course of lessons, and then they build the Alexander technique into their exercise. I've worked with a lot of people who do yoga, obviously a lot of people who do dancing, and they're able to build the technique into the other activities of their day that they do, and that keeps them going, and they continue to benefit from that then on for the rest of their life. Well, the Alexander technique is the technique. There are certainly principles involved, principles of movement, and these you might refer to as Alexander's discoveries, that he discovered that there are certain ways in which movement is organised in your body, the primary one being in the relationship of your head and your neck to your body. What Alexander referred to as the primary movement, sometimes we call it the primary pattern. And what we do is to look at what a person does with their primary pattern or their primary movement and work to assist them to improve that. We use our hands with people. We put our hands on people in a very, very delicate and very, very gentle manner in order to assist them to move more easily. And the technique involves teaching people to think in a different way and to appreciate their movement in a different way, so that by changing your awareness and your attention to your movement, you can actually create quite significant and sometimes quite profound physical changes.
Yes, there are different styles of the technique. As far as I know, that comes from all the master teachers that trained with Alexander originally, and they developed a little bit of a different style. So there's one lady in the States, Margie Barstow, and she was basically the only teacher at her time in the States, so she had to teach big groups. So that's why she had to adapt her teaching to bigger groups. And that basically influenced her style of teaching. Then there are other teachers who are teach more on an individual level. They might put their hands on a little bit in a different way. Some of them might talk more or less. I guess that depends on preference as well. And that gives the public, I guess, a choice to pick whatever they like out of that. So if you go to a teacher who doesn't talk much and you really need to talk about things, you might consider going to another teacher who is trained in a different style, and vice versa.
The principles of the technique are the same, providing that you go to somebody who has had a 3-year training or an appropriate level of training. There obviously is a society of teachers who looks after standards in relation to that. There are different approaches to teaching the technique. You could say there are 2 major schools in Australia currently. There are other divisions, and each teacher has their own particular way of approaching the work. So I certainly encourage you to shop around and to find somebody who suits you and who teaches in a way which is appropriate for you. The way that I work in personally is that I like to find out about what the person is doing for themselves, what their experience is, and assist them to change their thinking and their movement patterns by directing their thinking and encourage them to learn how to move in that way. I also use my hands to assist a person to have the new experience of what that can be like. There are some teachers who prefer to teach more by using more of the hands-on, and actually give more of an experience physically in that way, and over a period of time work towards that developing as a habit so that your habit of movement is improved. Yeah. So there are differences in approach, but the technique and the principles are basically the same.
Teachers of the Alexander technique claim that this method has helped people of all ages from all walks of life by improving their health, emotional well-being, mental alertness, and resistance to stress. The British writer called Aldous Huxley stated that this technique not only improved his physical and mental health, but also caused a general increase in awareness of consciousness on all levels. As a result of improved posture, many who have benefited from the training actually report becoming taller because they stand more upright. The technique has also been used to improve performances of athletes, dancers, and public speakers. The benefits obtained from the Alexander technique fall into 4 main categories: the relief from chronic conditions such as backaches, stiff necks, asthma, and headaches; the development of skills such as relaxation techniques to prevent problems such as tennis elbow; performance arts skills such as economy of movement for dancers and breathing, voice, presence, and carriage for actors; and personal transformation, which encourages self-responsibility and empowerment in developing responsibility for one's own health status.
Well, the benefits from the Alexander technique are fairly wide, but they tend in the beginning to relate to physical changes that can occur and that do occur when you work with a teacher. For myself, I had a lot of knee pain, and I had injuries from my neck and my back from when I was a dancer. And in all of those conditions, the pain went away after a few months of Alexander lessons. Just went away. What I found was that the injury was still there, and that if I didn't look after myself, I might get some pain back again. But the thing that was of great benefit to me about the Alexander work, and continues to be a benefit, was that if that happens, I know what to do about it. No matter where I am, on the street, at work, at home, I can do something to myself, make a little change in my movement, which immediately begins to relieve that pain and to improve my coordination. So in a very basic sense, the benefit that a lot of people get from it is their ability to control and manage their own pain themselves without having to be reliant upon others. But very much, as I said, that the technique is a preventative system, and a system which is looking to advance your coordination, your expression, your use of yourself beyond the normal, to improve that beyond the normal. And so, as a dancer, the benefits I found in terms of my physical expression, my fluidity and ease of movement, the actual facility for movement in terms of flexibility, how high I could jump easily, how I looked to people on stage, all of those things improved considerably. And in fact, so much so that after my first week of Alexander work, I went back to my dance company. I was still working with a company then. Every person who knew me in a professional sense as a dancer commented on the improvement. And I felt fantastic, felt just great. So even though a lot of people do come for pain relief, problems with their joints, headaches, stress headaches, those kinds of anything that relates to attention, any sort of tension-related problems will be relieved with this work. Really where I see the work as being most beneficial in the longer term is in taking people beyond their ordinary and normal mode of being and assisting them to be much easier, much more comfortable, much more fluid and much more present in the way they are.
Well, the Alexander technique assists in basically any tension-related problems, so that can be any kind of aches and pains. Now, it doesn't cure conditions. If you have an illness or a disease, it doesn't cure that, but you learn how to release tension that is brought about by this condition. So when you are in pain, maybe because you have arthritis, it doesn't cure the arthritis, but because you're in pain, you start tightening more, and you get into this vicious circle of tightening more and more, being in more and more pain. So you learn how to release this tension a bit more, use yourself more efficiently, so the joints have less pressure on them, and that ultimately might result in less pain. I have people coming for anxiety attacks or lack of concentration, and it always relates to how they use themselves physically. So you can always work on releasing tension in the body, which changes your whole approach.
The following is a list of common complaints with which the Alexander technique has been said to benefit: depression, anxiety, headaches, high blood pressure, tension, exhaustion, respiratory problems, ulcers, bowel problems, arthritis, sciatica, and asthma.
Well, originally I started to have lessons myself because I had severe knee pains, and I was training as a physio. I did all these exercises, did jogging, and nothing really helped me. So every time I got in and out of a chair, I had this pain, and that really worried me, thinking about my future and how I might end up and everything. So I thought I might try this technique, didn't know anything about it. And after a few lessons, my teacher took me out of the chair, and I didn't have any pain getting out of this chair, and this was like a real revelation. I couldn't believe it. And I learned gradually how to do that myself, releasing this tension that I had in my legs. And now I've hardly have that pain anymore unless I go skiing for 2 weeks or I do severe backpacking for a long period of time. But this has improved my condition very much.
When you come to do lessons with a teacher, the teacher will, after the first session, be able to inform you how many lessons they feel will be appropriate and how frequently you should come. For myself, normally people come to lessons once a week. Sessions with me usually last 45 minutes to an hour, and we recommend that people do undertake a commitment of time to create these changes. It's not something that will happen overnight. It's something which does take a certain amount of work and a certain amount of time. And what we suggest is that people begin with a course of 10 as an introduction, perhaps take a break at that time and work a little on it for themselves, and then return for anything from 20 to 30 sessions in total. Now, obviously that does vary with what people require and what people like. Some people within 10 lessons have the pain goes away and they're happy with that, and that's it. And they know how to do that, that's fine. Some people find that they become interested in the deeper levels and the more subtle levels of the technique, and they continue to study for a considerable period of time. I mean, I know for myself the benefits in terms of my movement and dancing, and then the unexpected benefit it was for me at the time of the relief of pain from injury conditions led to me developing a fascination with this kind of movement. And of course I went on to study in a full-time sense and became a teacher. Some people go to lessons for a number of years. But what we recommend is a beginning set of 10 and then another set of maybe another 10 or 20. It can be over a reasonably long period of time, but certainly the first set should be at least once a week.
Well, people come to private sessions, they usually come for 10 lessons. That's what we recommend. There's no commitment for them. They can come a few times, drop out. They can come for 2 years. But with 10 sessions, they would get a basic understanding and the skill to do it for themselves. Now, the first session lasts for about 1 hour. That's what I do. All the following sessions, they last for about 45 minutes, depending on what we're working on. And usually that would involve some kind of activities people bring in, daily activities like sitting, standing, walking, bending, special activities if a singer is coming, of course, do some singing or whatever people's needs are. And then it involves also a lying down session on the table, so that's kind of a relaxing part where I would adjust very gently people's bodies. So you can be in your habit, which for her was leaning to one side and pushing down on one side. You can be there so you have more weight on one foot. And you can move out of that by still having more weight on one foot by moving up, but you can also balance back into the middle. So the idea is to integrate Alexander's principles into every movement. So basically what I was teaching Kylie in that session, first she did it by herself, whatever she did, the movement she did, whether that was sitting or bending, to observe what she's doing. So observe some kind of tension somewhere. And I usually start with head, the relationship of the head to the body, because often things like this happen and that's very easy to notice. So then I assisted her in moving out of that by moving her head in that particular way to release more tension and to lead with her head rather than pushing herself up. And the third go is kind of her doing it for herself to see whether she's able to do a little bit of that for herself or not. Now, this is not perfect. This is a process. So I'm after improvement. I'm not after perfection. And you can see in this clip that she has less tension in her neck when she does it with me or when she thinks about her Alexander technique. And when you look at Kylie standing, you might see that her knees are pretty well locked all the time, locked back. So she might release up in her upper part of her body, but obviously she doesn't include her knees yet. So the idea is to tell her every so often to unlock her knees, to release her knees a little bit, which might help her to remember. Now in walking, you might have noticed that when Kylie turns around, she moves her head together with her body, so that looks a little bit stiff or a little bit rigid. That happens very often because people get caught up in, oh, I want to do the Alexander technique and I move my head and move my body, and then they keep they keep it there, they freeze their body there, and that becomes a little bit stiff. They hold the posture. Once she starts moving her head, she said, oh, this is much more natural. Now she might still put a little bit of pressure on her body as she does that, but it looks more natural. The idea is to have her still interacting with the world and be fairly fluid in the way she moves and behaves, and not just look like a robot. When Kylie's lifting the heavy basket, you can see that she uses quite a lot of tension in her neck, in her arms. You can, I think, even hear her knees crack. And it's a very brisk movement that she does. And she probably thinks about lifting this heavy basket. So she is expecting a weight. Now when she does it after that, she thinks more about herself. She doesn't care that much about the basket, so she thinks about how easy she can make it for herself to bend down. And then the basket becomes secondary, and she just happens to lift it more than before. Well, I've had a very young woman coming to me because of her posture, but as it turned out she also had anxiety attacks, and she was sitting always a bit like this. And so we worked together on how she could move out of this and integrate that in her walking, in her talking to people. And she had anxiety attacks the more people were around, so that was kind of critical. The more people were around, the more prone she was to get an attack like this. And she started to release and move up, to use her Alexander principles when she got closer to people, when she met people. And all of a sudden she comes to me and says, I haven't had an anxiety attack for 3 weeks, which was the longest that she could remember. And we just continued from there, and she didn't have any more until she stopped coming. So that was kind of a very special case, because wasn't obvious just posture. I've got a lot of people come to me with some back pain, tension, because they're stressed, they have a stressful job, they might do some sport in their free time, and then they come and have a really bad back, or they might go and have massages then to release that. But they're like in this cycle that they work hard, they do sports, then they get treated, have a massage, then they feel better, and then they fall back again. So I had a few people there realizing how much they put pressure on themselves without knowing before, and being able to use the technique to release that helped them.
The Alexander technique is certainly an experience that is unusual, and an experience which is best experienced with the hands of a competent and trained teacher. And there is a lot of information available in books and on videos and so on, all of which is useful as ancillary information to doing lessons. Alexander himself, of course, didn't have anybody to help him, and he worked it out for himself. But it took him almost 10 years, and he was obsessed with that. Now, people can take advantage of the fact that he did that by going to somebody who trained in the manner which he learned. The technique itself leads you back to a fluidity and a naturalness in your coordination and your movement. So you don't really have to worry about how you're moving. You find yourself moving very easily and very easily and very lightly. If you find with your practice or your experience with the technique that you seem to be becoming a little stiff or a little rigid, or you appear a little held, or maybe people comment about that or something, well, then you know that you are perhaps trying a little too hard, and you should ask your teacher to assist you to relieve and release that heldness.
Well, I think it's important that when somebody's interested, it is important for them to get a practical experience. You might see a video or you might read a book and you might get some idea, but the most important thing is how delicate, how gentle you apply that to yourself. Because we have been all moving in certain movement patterns all our lives, we wouldn't know how to move differently. So we have to get somebody else to show us that, even if it's just an experience. Mind you, Alexander did it all by himself, but he said, you can do what I did if you do what I did. So that means we would have to sit in front of mirrors for months and months and be really meticulous about observing ourselves and using our error and trial and error for finding out what we could do differently. And I don't think a lot of people would put that effort into this.
There are a number of misconceptions about the technique. Some people think that it's all about your head and your neck. And while your head and your neck is certainly very important in the technique, that's not what it's about. It's about the whole of the way in which you move and how you think in relation to that, your awareness or your attention to your movement. Yeah? So much broader than just your head and your neck. Other misconceptions, people often think that it's about posture. And of course that's understandable because your posture improves considerably when you do this technique. It really does change. But the change comes about because of the difference, the ease in your movement. Not because you have to sit up straight and do the right thing. Sitting up straight and doing the right thing is very uncomfortable, and it's certainly not what I do. So it does produce benefits in posture, but it is not really about posture in a conventional sense.
Officially, it's a re-education, so it's a posture movement re-education. And a lot of people think it's about sitting straight and being like that all the time, being perfect, not doing anything else anymore, just being perfect. And it is rather a process towards improvement of your movement. So it doesn't mean you have to sit straight all the time. It means that you can be slumped sometimes and have quite an easy slump like this, or you can be slumped heavily and put a lot of pressure on your joints. So it's about more quality of movement rather than having the perfect posture.
Some people do confuse the technique with treatment, and there are certainly therapeutic benefits and uses of the technique which are therapeutic for people. And in that sense, I suppose you could say that it was a treatment. But the aim of the technique is to educate you, to teach you about your own coordination and to teach you how to change that for yourself. It's a skill, like learning to ride a bike. You're learning to use your body in an improved way. And when you have that skill, you simply can use it anywhere you choose.
Recent scientific studies have reported that the Alexander technique is very beneficial in restoring natural posture by the connection between anxiety and physical tension.
There have been a number of scientific studies done in the technique, starting back, well, quite a long time ago. The major one that I have used as a reference was done in the 1970s and 1975 in America. The current head of the physiology and pharmacology department at the University of New South Wales in Sydney, Dr. David Garlick has been studying the technique in his laboratory for about 10 years. He also, incidentally, is training to become a teacher himself. And his research has shown up many of the underlying mechanisms, physiological mechanisms, for why and how this works. The research is not complete by any means, but he has published materials on the research to date, and those are available. He's published a book called The Lost Sixth Sense, which is available through the University of New South Wales, which outlines some of the physiological principles and actions, the things that actually happen with your muscles and your nerves and so on. There have been a number of doctors who've been educated in the technique, and a lot of doctors these days find that it is beneficial for people as an adjunct to their normal medical treatments. Again, recognising that the Alexander technique is essentially educational and that it's teaching you about your movement rather than attempting to fix you. Well, I have had experience with a number of movement re-education systems, largely through my dance experience, but then subsequently in my training. There are a number of systems which could be broadly classified as somatic re-education or mind-body re-education, and under those I would include Feldenkrais, idiokinesis, body-mind centering, release, what's referred to as release work, and of course the Alexander technique. Now, each of those methods has something of the quality of mind-body re-education, educating how you function, how your nervous system functions to create movement. The methods differ considerably, and I have had, well, having had some experience, not a great deal, but some experience with Feldenkrais, it seems to me that the difference between Feldenkrais and Alexander is that Alexander is based upon and relies upon a central principle and a series of central principles, the primary movement that we mentioned earlier on. Feldenkrais seems to be much more general in that they're looking at all sorts of movements, all sorts of movements, all kinds of things, and how can you increase the efficiency and the ease of doing those. Now, of course, Alexander does result in ease and increased efficiency in doing all sorts of movements, and it does it through the application of this central principle.
It is very unique in its approach to re-educate, basically, our movements. So you learn how to move more easily with less tension, and you learn how to do that for yourself, which I don't think you do in many other techniques. And I find that quite unique, and it's a very gentle method, so you can use it, all age groups can benefit from that. I would like for the technique to become more known, because these days it's still, when I promote myself, I have to always say what the technique is about. So I would like for people to know about what the technique is, so it's more readily available for them. And Australia, maybe for teachers to spread more out throughout the country, because it's still more or less in the big cities that you can go and have Alexander lessons, but in the country it's not as available.
Well, the Alexander technique is becoming increasingly well known. It has been around for over 100 years now, and teachers have been working and developing the technique and their manner of teaching since then as a very established means of training. It's becoming much more established as a profession these days. So many people have had beneficial experiences from the technique now that there's been quite a great demand engendered, and so there are more people training to be teachers. I think that it will expand to the point where it becomes much more well known, basically, and a little bit more like you might see, everybody knows about physiotherapists, yeah, and eventually I see the technique as being that well known and that well used. What I would hope to see is that it would be introduced into preventative training of some kind, either in physical training in the schools or in some way to assist people not to develop the delimitation, the injury, the habits of tension, the unconscious tightenings that people have in their bodies. They can be avoided, and that's really what I hope the technique will be able to do over the years.
The Alexander technique is a natural, holistic method promoting the body and mind to release tension and allow movements to be more natural and relaxed. Acquired bad habits can be replaced with gentle movements which ultimately aim to allow an individual to move in a more harmonious state with maximum efficiency and minimum effort.